I'm Heather Venegas, and you're listening to King County Recovery Conversations, a place to celebrate recovery and help break the stigma of addiction and mental health. Today, I am joined by three amazing recovery champions that are connected with our local recovery high school, Seth, Aiden, and Karis. Aiden and Karis are two students at the school. I would love to start, Seth, and ask you if you could tell us what Interagency Queen Anne Recovery High School is.
Yeah, absolutely. Thanks so much for having us here today. Again, my name is Seth, and I'm the drug and alcohol counselor, the substance use disorder professional, and recovery counselor at the Interagency Recovery Academy. It's a Seattle's only, well, and really Washington State's only sober public high school that's based off models that were throughout the country. And this school has been around since almost 10 years, so like late 2014, early 2015. It's a school specifically dedicated to teens that are in recovery, primarily from addiction, but also substance use, but other disorders as well.
Why is something like this school important for youth with substance use disorder?
Yeah, that's a great question. I think that sort of the birth of recovery schools, recovery high schools, nationally, they're about a little over 40, probably upwards of 50 now, hopefully, came out of this kind of this recognition, and also from data that demonstrated that relapse rates were relatively high for young people coming out of residential and outpatient treatment programs. They just weren't able to sustain sobriety all that well when in so many cases the common occurrence was for somebody to go to treatment, have this, potentially impactful experience, and then come right back to the exact same environment that in part fostered that, the worsening of that addiction. And so, the brilliant minds came together to decide, to say, well, what if we, school is better part of 6 hours a day. What if we came together and had all of them building community like that for a common cause, in addition to getting their education? So that was kind of like that was how recovery schools came about.
And it makes so much sense, right? Because like slippery places, people and things, like going back and being right where you were with all the pressure and maybe your using crowd that you were friends with, and trying to be the person that's not doing that would be so stressful, especially in high school. When there's so many other things that are going on, and being with your family. I love the idea and this incredible model of having a place for youth to go who have that shared purpose of being and growing in recovery and building their own community, and having the opportunity to support each other, and also finish high school and graduate and go on with their life and be like incredible, sober, recovering youth champions. That what I've heard is that not only have the students at the school created this incredibly strong community there, but there's been a huge ripple effect out into the greater King County area. And that it's impacted our recovery community. There's young people's meetings and things like that. Would you speak to that for a moment, how that came about?
Yeah, so one other thing I wanted to note as well, that, was kind of the precursor for this progressive idea of a recovery high school is, in addition to extremely high relapse rates, relatively quick coming out of treatment. In addition to that, what were very low graduation rates for students that had participated in substance use treatment. And so absolutely, like you said, this idea that we're going to build community here in the school. And I think the thing that is one of the most impactful things that I've been able to witness and hopefully have helped contribute to is the one thing that I found to be unique in this setting is that there is the cultivation of leaders. These two and others are leaders within their community, and not just evidenced by their fairly substantial sobriety dates, which I think they'll share with you, but it's the quality of their recovery during that time, and the fact that they're then still, I mean, they're going to graduate here pretty soon, right? But which is amazing, and of course they're going to do that and go on to do great, wonderful things. But the fact that they're still, after multiple years, are here for the incoming students is pretty groundbreaking. There's just not a lot of places where you're able to, cultivate leadership and then see young people transform their lives in recovery well beyond just the absence of substances, but actually transform in such a way that they can then, there is a institution that is providing that direct connection for other students when they come in. To give you an idea, we have students with over a couple years sobriety, and we probably have students with about a week or maybe even less as of this exact moment, right? So the other thing that you mentioned was absolutely the ripple effect. And what I've seen with that, which I think they will actually be able to speak to probably a bit more articulately, is one thing. It's kind of become a hub, like if I can say it that way, that the school it's a bit of not necessarily a meetup spot, because it is a public school, and so it's for those that are enrolled in it. But we have guests that are coming every week. We have students. One of the most interesting referral sources that's probably been the most profound is students referring their own friends, and so they'll come up and visit and hang out and do recovery support with us, which is like our own in-house meeting, and then afterward they go hang out and fellowship. They go to meetings. And so that community that they've built within far is carried outside as well. And so they're having impact, on all these different kids and, in the community and adults as well. And I think the biggest thing that I've seen happen is since this school has been around and the first cohort really truly got sober, like maybe in 2016 or so, the school's never really looked back in terms of the culture embodying like that recovery is cool. Like that is the thing that we're doing here, and you can be a part of that. And that's, I think, probably the coolest thing that I've got to witness, because it's changed the face of what recovery looks like. It's changed the demographic completely in Greater Seattle, of who's in recovery and who it's realistic for.
That's incredible. Aiden, would you tell us a little bit about what your life was like shortly before you found your way to the recovery school, and then how you got there?
Yeah, before coming to the recovery school, I actually was a daily user of fentanyl. Like, it was pretty bad. I started at like a young age using drugs and experimenting, but it got to a point where it was spiraling out of control really quick. I ended up doing fentanyl at I was almost 15 when I started, probably 14. It was really bad. I didn't have anything. I didn't care about anything, not my family, not my friends. All I cared about was getting high. You know what I mean? And I ended up overdosing and going to treatment. I was in treatment for a year in Montana. It was the best thing that ever happened to me. One of the actually past alumni from IQA went to the same treatment as me. He's still sober today, and he actually got me and my family connected and my rehab connected with the school. So I found out about the school from him, and I came to the school in early 2021, I think, maybe late 2021. And, it was a change from my old life, you know what I mean? Like, from using every day to like having no friends and having no family that like I like had a relationship with, to like now being at the school with almost 2 years clean. I have 20 months and some change.
Congratulations. And right on.
I have things that I never had before. I never thought I would have in use, because all I could care about was getting the next high. But being at the school, I have friends and I have a strong relationship with my family. So my life is like, complete opposite, like polar opposites from each other. Like if you would have looked at me 3 years ago, you would have been like, this is not the same person that you're looking at today, you know? And these guys haven't seen me in use, but like you wouldn't have recognized me, you know, 3 years ago compared to now. So, yeah.
How about you, Karis?
I guess my origins of use were also really young. I was probably 11 years old. And, you know, I don't have to get into the details of the what and where, but there was a lot, and it was everywhere. And I think around the pandemic is when it got, like, it's worse, because I dropped out in 8th grade, because that was when the pandemic hit for me, because I'm 17 now, and just started using, like, fentanyl, and pretty much, you know, whatever I could, but, like, I feel like I would do, like, the worst the most, because I was really suicidal at that point in time, and, like, I had a lot of outstanding issues. Like, I was, like, really active, like, being, like, actively traumatized within my addiction, which just made it worse. It was just this huge spiral of use and then get traumatized, then use to cope with my trauma, and, like, continuing because I had already, you know, ruined this childhood, and, like, there wasn't any saving me. And I think it got to a point, like, I was in and out of hospitals, from, you know, I went to, like, 11 inpatient hospitals and, like, 2 rehabs. My first rehab, I relapsed, like, right out the gate, just because it, you know, I didn't really have any willingness to be clean. It hadn't gotten bad enough for me yet. And my second, I realized that there was a chance, and, you know, I was getting older, and there was a way for me to turn it around, and I think I got sober November 7th, November 11th of 2021, and started coming to the school pretty shortly after that, and yeah, I mean, I've been clean and sober, and, like, working a program ever since then, and now, you know, I have the chance to take other people through the program, and yeah, it's, like, it's really wonderful. That's my villain story.
So what is it like now being at the school for you?
In this current day and age, it's really, it's not crisis anymore, and it's not stay alive and try and find happiness. It's, try and graduate and be an adult. And, you know, I think that, you know, me and Annie, I know that Aiden could, it's a similar story, but, like, I had to grow up really fast, and, you know, but now it's a point where it's like, you gotta move out and you gotta do all these things. So that's kind of, like, where my focus is on. And so I have that extra space in my life to be able to, you know, help some of the younger kids that are going through it, which is super important for me, just because, you know, I think that service, it really keeps me sober. And I was at that spot that these kids were at. And so, yeah, I guess my goals and ambitions have changed, but, like, the one thing that has remained a constant is that I have this, like, even though my life is very separate from the school, and I have a lot of hobbies and interests that don't conflict, but, like, are just not related to the school at all, and all my friends, you know, I have a very separate life from the school. I have this medium space where I get to be around other youth in recovery, and have help and give help, and just have, like, a generally safe space with people that I know and trust and care for and love. And so, yeah, I think I think my relationship with the school has changed, but I don't think it was negative at all.
Wonderful. Thank you so much, you guys. Seth, let's talk about you a little bit. So when you were high school age, you were getting into things your own self, and went through treatment a few times, and you have quite the story ending up with that hitting a semi
Yeah.
15 years ago. You want to share a little bit of that with us?
Yep. From high in high school to crashing into semi. Yes. No. That's exactly. That made me think. In high school, I was just trying really hard to be cool, I guess. I would have never admitted that at the time. I actually felt like I put a lot of work into wearing a mask into a certain social group, and that was like very stressful for me. I honestly felt, I think I heard a speaker, like a circuit speaker, say something to the effect of like, I didn't really know how hard sobriety really was until I got loaded, until I got high and was like, what? Like, this can be the experience? Like, this is the alternate reality that I very quickly felt like, why wouldn't I just be a little bit high or intoxicated all the time? That would just make, not just inebriated, like not obvious, but just a little edge off, and clearly, like me and so many others, I just would so often miss the off ramp of that. And so by the time I was going into junior year, my parents were fortunate enough, like as Aiden and Karis, to help me, to trick me into going to treatment, along with the other 9 people that were tricked into doing it. And that was like the first awakening, where we sat in a circle, and all the parents, are sharing why they brought their kid here, because we were all tricked. And I ended up going last, which was like, I don't know if that was meant to be, because I had my whole pitch. I was going to blame my parents, and you don't know nothing, and you're getting carried away, and you're just wasting your money, and how dare you don't know me, all this stuff. Very entitled stuff. But the problem was that every single other person just stole my lines right before that. And then when, how you can so clearly see in others what you can't see in yourself. And Absolutely. It just felt ridiculous. And I was like looking at these parents that are crying, and I don't know them, and the kids all bitter. And and I was just like, oh no, like we're all wrong. We're all wrong. We're all messing our lives. It was just, and I had never even thought like that. I was around people at that point in time that were like, you should run away. You should not go to treatment. That's for losers. You should run away. And not everybody. There was some people that were like, no, you definitely need to go. Young people as well. But, and then fast forward, what I didn't understand was coming out of treatment, I was like pretty stoked on that experience. I got to be in the wilderness for a month or so, and I really started feeling better, started feeling healthy. And it clicked for me that sobriety was like kind of the righteous path for other people, like that those that would do this will do well in life, and they'll probably help a lot of people. But what I didn't understand was like that I think from that point, marijuana, like weed, was done. If something switched for me that I could never enjoy it again. I'd practiced smoking weed alone. I just get super paranoid. And before that, I smoked every single day, for 2 years. And then what ended up happening was, the long story short, was I completely transferred that addiction to alcohol, among other drugs, and just started racking up a bunch of legal problems. And then I got to deal with addiction as an adult, in poverty, basically. I still had some support from my parents, so like I could go back to their basement if they would have me, kind of thing. But it quickly fell apart, and I ended up with 4 DUIs, multiple disorderly conducts, a lost career in the military, and more important, bigger than all that, like the inability to see a future in any way, shape, or form. And so that was the beginning of sobriety. I had nothing better to do than to go to 12-step meetings while I had an ankle monitor on. There was nothing else. It was like, I may as well. And it turned out that community was very different than the one that I thought that I would walk into. And I love it. I love it to this day. So, yeah.
Thanks. And when we spoke before, you shared that there was one person that you would attribute to helping you save your life and getting you into recovery back in the day. Would you be willing to share a little bit about that and your relationship and the school?
Yeah, absolutely. So in high school, I ended up going to Nathan Hale High School, and for a little while, well, for quite a while, I was joined by a friend of mine there who we had gotten pretty heavily into addiction together, which his name was Ben Haggerty, which for people that don't know who that is, that's Macklemore. And I can honestly say that he was already very much a leader, I would say, in our little community, and just like a lot of people, I would say, looked up to him. He was always the guy with the plan kind of thing. And he was the first person at probably like maybe 14, 15 who was really starting to seriously consider sobriety in a way that most of us were. That was the first thing that he came with that was not really cool. You know, you're like, say, what? What are you talking about? Like a break, like a tolerance break? Kids talk about that now, you know, like that kind of thing. But like you're talking about as a lifestyle. Look how young we are. Why would we possibly consider that? And he evidently a sixth sense or tapped into a higher power even at that age or whatever, that I think he knew that he wasn't going to be able to amount to a whole lot or certainly not fulfill his destiny, so to speak, if he wasn't sober. And so he was the one that actually he like helped stage a couple interventions for me. He kind of went to my family and told them, you don't even know the half, and the half is too much, and he needs to go to rehab for sure, which I felt like was complete and utter betrayal, of course. And I'm very grateful to that for this day, and we still have a very strong bond and relationship, and due to different struggles that we've both had, I've been able to, he was absolutely the first person to take me to meetings and everything like that, and I've been able to, I hope, return that favor and service to him, and when he's had times of struggle, and then bigger than us, and much more importantly, he's been definitely. I mean, he's actually done a lot more for the school than people even know. Certainly financially, and paid for a whole bunch of stuff that I can't even remember. He's done enough stuff that I can't even remember all of the things. Just offhandedly, but like he's single-handedly paid for several people to go to treatment. He's come up and chaired meetings. And I think even bigger and then bigger than some of these. Yeah, he's taken some of the students to California and all. There's just like a bunch of things that he's helped us do. But I think probably honestly one of the stronger things is just his presence in the recovery community. We kind of sometimes organize and maybe we'll go to some of the same meetings together. So I would say probably in the history of the school of, hundreds of students, a good majority of them have got to meet him and have that be just recognize that he's also just a normal guy trying to recover. And he's very open about, looking up to some of them as I do, as some of them have been able to accomplish things that we have not been able to, So he's been a huge ambassador and just ally to the school in countless ways.
I love that story. That's so amazing. Thank you. And thank you, Macklemore. So cool. And it's so interesting how, as someone in recovery, on May 5th, I'll be celebrating with my higher powers help. I'll be celebrating 30 years, no drugs and alcohol, after many relapses and all the things you guys were talking about. And, for me and for all of us, it's that key to recovery is service, right? And what a wonderful way that Ben has been able to be of service to the youth and the school. I love that. And you to each other. there's so much I want to talk about, and I'm mindful of our time. I know that you've shared with me, Seth, that Oregon has a model that they're now implementing where they are going to have recovery schools across the state. And could you share a little bit about that and like what that could look like for Washington?
Yeah. So recovery, or Oregon has a recovery school initiative where, like, presently, I believe they have two recovery high schools. One that's situated in, like, kind of the, Portland proper, and then one that's like a little bit outside in one of the kind of suburbs. And they were able to get together with I'm not even sure fully how this happened, but I'm trying to find out more exactly because it's just groundbreaking. They came together, got involvement between, key stakeholders and legislators and school and district officials and state officials, state involved. That's where this kind of gets interesting is they're getting ready to establish, I think it's 9 recovery high schools. It's either 9 or 11. It's either 9 more, or a total of 9 over the next, I don't know, couple years. So I'm imagining that they're going to be strategically placing those throughout in various counties and stuff like that. But one of the things that they did that was pretty groundbreaking is they were able to get these to be state-funded schools, and so they're not competing for district dollars. So these are state-funded, much like a school for the deaf or blind that doesn't need to be in any direct competition with any other type of programming, right? So that sounds like a model that should be emulated by all states, Washington first and foremost.
Absolutely. Wouldn't that be amazing to have recovery schools be the norm in every area, no matter where you live in our country? And if you have a youth that's facing substance use disorder and mental health challenges and needs a place to be in community with others who are their peers, that it just happens. They're just automatically, oh, you need to go there. And there is one for, all the families and everyone to access. I love that. I love that vision. What would you say, you guys, to what communities could do meantime while we work towards implementing something like that here?
Like communities of young people? Is that what you're asking?
Yeah, or schools, and just like what can we do if we don't have funding right now to plop a recovery school in South King County and one over on the east side and one up in Snohomish County and so forth. Like what would you encourage? What do you think would be important for communities to put into place for their youth?
Well, I think a main thing, at least in my opinion, is spreading awareness, because I feel like there's so much lack of understanding of what this disease is and how it affects young people and just anybody in general. Like, I feel like this year has been, like, compared to last year, this year there's been so much more, like, outreach and trying to connect. Like, we did have, like, outreach and, like, we were spreading awareness last year, but this year we've been, like, trying to spread the message to people that don't understand this disease so much. And I think it's really hard to get, like, put things in place without resources. So I think, like, building a strong community, like right now, I know so many young people that are in recovery that have a strong community because they did it themselves, not because it was given to them by the state or by districts or anything. Like it has to come from within. And that's why I think awareness and spreading the message, like what we're doing right now, just talking about it, it gives people like a place that they're like, okay, this is a thing, because before, like when I was in youth, I didn't even know that, like, I didn't know what AA or I didn't know what 12-step programs were. I didn't know what recovery was. I didn't know anything about anything. You know what I mean? So talking about it and spreading awareness, at least in my opinion, is probably one of the most key things that can be done. You know what I mean?
Yeah, and I think that, right now more than ever, so many kids are dying that I think that a lot of our local schools and just institutions that help or deal with young people are really being ignorant to this fact, because it is a scary one. No one wants kids to die, but it is happening, and it is constant. And I think that now more than ever, like what Aiden said, we should be talking about this. And if you honestly just giving these kids a place to be that is not gonna be judgmental, or not gonna I think that really just having a place to be that kids understand that they're loved and accepted no matter what they're doing or what they're going through. Because there is this level of, like, when I was going to public school, at least, and I was in addiction, like, there is this level of, like, you are, I guess, can we swear? No. There's this level of just being treated like you aren't necessarily human, because it's sort of taboo to a lot of older folks. Like, they're like, it's just, kids are just gonna experiment, which is true, but as more and more drugs are you can't experiment with fentanyl. You can't, because you're gonna die. Like, it's just that sort of, like, making sure that that it is that. I guess what I'm trying to say is that schools are aware that this is happening, and that besides that, also just, like, more resources for housing and food, and because we all know that, like, addiction sometimes stems from like financial insecurity at home, and not having adequate mental health resources. Anything could not even just cause it, but amplify it.